And a battle is brewing between legislators who don't want new mandates placed on health insurance companies and lawmakers who have several bills pending to do just that. OETA's Lori Rasmussen reports that families with autistic children are caught right in the middle of it all.
10-year-old Nicholas Rohde was diagnosed with autism at age 4. His parents knew something was wrong when he wasn't learning language as fast as his twin brother Austin. Getting the diagnosis was the bad news for the family. The real shock came when they learned their health insurance wouldn't pay for any of Nick's treatments. Oklahoma does not require insurance carriers to cover it.
Yet, autism is a medical condition that is not covered. So why is there a discrimination? Why is there an exclusion for autism diagnosis?
Nick's treatment cost the family almost $4,000 a month out of pocket. That's in addition to the $1,000 each month they pay for health care coverage. His dad, Wayne, decided to take action. He's pushing for Nick's Law, a bill that would require insurance companies to cover autism.
Setting aside for a moment the fact that this mandate would change lives for the better, it will also eventually, in our belief, save taxpayers money. Early diagnosis and treatment is the best way to ensure that autistic children have a chance of reaching their full God-given potential.
Texas is one state requiring insurance companies to cover the cost of autism treatment. One reason why Nick has to go to Dallas for treatment, his mom Robin says, is because few doctors in Oklahoma deal with autism, since so few parents can afford the treatments. She says he was misdiagnosed for 2 years, and those years could have made a critical difference.
I look at this little girl who's had early intervention, and she raises her arms up to her daddy, but Nicholas didn't have early intervention. And so it's so important for these children to have this law in the state.
Senator Jay Paul Gumm is sponsoring Nick's Law, but says he's facing an uphill battle. He says he didn't think it would pass out of committee because of opposition to any sort of insurance mandate.
The truth of the matter is the free market isn't working in this. There are children who are being left behind. There are families that are doing the right thing. They are paying for health insurance and not getting coverage.
Gumm says instead of going through committee, he'll add the proposal as an amendment to other insurance-related bills this session. One autism bill that did pass committee muster is Senator Mary Easley's proposal to require more training for public school teachers in dealing with autism. 4-year-old Spencer Frost was diagnosed with autism at age 2, and he's doing well in a class with other kids with learning delays. The goal is for Spencer to eventually go into a mainstream classroom, and his mom said early intervention made the difference.
Senator Easley's bill is going to help the teachers to do the right things for these children for the early intervention, because that's exactly what they need.
Lawmakers do add that parents who simply cannot afford to pay out-of-pocket expenses for an autistic child do have the option of going on Medicaid, but for most families the waiting list is 4 years long. A child is usually diagnosed at age 2, and that means intervention during critical early years simply won't happen. At the state capitol, Lori Rasmussen, Oklahoma News Report.